I'm 69. I'm disabled physically, and I live on a very low income. It's just under $1,200 a month. So, $300 a week doesn't get you that far. I'm really good at budgeting. I have to be, but it's really difficult, and I am terrified. I'm just afraid because what my Medicare doesn't cover, it rolls over to Medicaid. Medicaid helps pay for my prescriptions. I live in a 55 and older community. I have many neighbors and friends who this will affect. We're all terrified.
Let me just say it passed out of the Senate, even though we put up a fight to either stop it or improve or take away the deep cuts to Medicaid. It passed out of the Senate because the Republicans all had control and they stuck together. And now it's in the House. And the question will be what the House does with it. But let me ask you this. What would happen if you did not have Medicaid? If you couldn't access Medicaid, how would that impact your life?
I will not be able to pay deductibles, medication. And trust me, I'm not the kind of person who I've owned several businesses in my lifetime, and I have worked hard since I've been 16 years old. It's just the disability has taken me out of the work field, and I will lose medical care. I will make decisions that will affect my life. I live in an apartment, like I said, 55 and older. I don't know whether I'll lose this apartment. I don't know if I'll be able to even afford the rent that I am given to pay if I lose my medical. And I don't have anywhere to go.
I think some of my colleagues who are imposing some of these draconian new rules forget that what it's like for many Americans just living day to day. People need an opportunity to get through the day and access essential health care and have a roof over your head, right? Roof over your head, food on the table, essential health care. That is knowing that you can access that. That's part of health care. That's part of the comfort that you just saw that brings less stress and more opportunities for good health if you know you can access the funding that you need to get through. I think it is powerful that we hear stories from folks, real life stories of the impacts that they're feeling, because that's going to change, hopefully, the provisions and the policies in Washington and other places where they see people do not want it, and they're demanding change that is positive for them, not negative. So
the more voices that speak out, I believe in the people. The people will turn it around. It's going to be a hard fight, but thank you. Thank you for being our voices.
Absolutely.
Thank you.
Karen, thank you for getting on the call with me. Thank you again, and we'll stay in touch, okay?
Thank you for your time. Have a great day.